Hi, this is Dr. Jason Torado, your West New York chiropractor, and today's health alert we are talking about whiplash. So this is number 2 of your whiplash alerts. You know, there are different doctors and different approaches to care. And you know, while whiplash injuries are a serious, significant public health problem, not only do they actually cause terrible pain and a lot of time out of work, and also a lot of time that takes out of your own recreational leisure activities, but there's also a general effect on the quality of your life. You know, a study in Europe, the Spine Journal magazine actually compared female patients that had neck injuries, whiplash injuries, to patients with lower back injuries and another group with rheumatoid arthritis. And the researchers actually looked at pain levels, just pain levels, whether it was high or whether it was low, and how the quality of life was affected in the whiplash group. The study showed that the pain actually was highest in those people that suffered with whiplash injuries to their neck. You know, a study in the journal Spine actually looked at how medical doctors and chiropractic doctors actually differed in their approach in how they actually treated and took care of patients with whiplash accidents. And it showed that medical doctors were actually much more likely to have negative overall feelings about actually treating patients who have whiplash. I mean, think about that. You know, they actually have negative feelings about treating patients that have been in car accidents. And they were almost likely to believe that there was nothing physically wrong with many of the patients that were in a car accident or who suffered with chronic whiplash. Whereas in terms of treatment, most of these medical doctors, they believe that things like non-steroidal anti-inflammatory drugs, you know, the aspirins, Tylenols, and the ibuprofens, and things like muscle relaxers were very, very effective in cases of acute whiplash. You know, this is despite the significant scientific evidence of problems of safety with long-term consumptions of steroidal anti-inflammatories, right? Things like stomach bleeding and things of that nature, stomach ulcers. You know, in addition to questions of safety of these non-steroidal anti-inflammatories, there's also virtually absolutely no evidence whatsoever that these types of medications actually improve a patient's life or their overall quality of life. So why recommend these things in the first place? Now, the chiropractic approach, on the other hand, the approach to whiplash, it's a lot more different than the way a doctor is going to take care of you. Number one, first of all, most chiropractors, because they understand the nature of these car accidents and these whiplash injuries and the effect on the neck, they actually believe a patient when they say that their neck is injured. They believe a patient when they say that their neck actually hurts after a car accident or even months after a car accident. I mean, that's the major difference between your medical doctor and your chiropractic doctor. Now, I'm not knocking the medical doctors, but I'm just saying this is just the general overall idea of what's going on. You know, most studies actually of auto accidents actually show that the injuries in car accidents and whiplash injuries are real. And mostly they consist of things like sprains and things like, not dislocations, but a little bit less, these things called subluxations of the joints inside the neck. You know, the spinal ligaments and the muscles and all the discs, they're all affected in a whiplash injury. And when trauma to these tissues occur, it's the sensitive nerves that actually go in between these structures. It's the nerves that also go and become very, very damaged, and the results in severe pain and sometimes in lifetime pain. And overall, over time, it could actually have a serious, serious impact on the patient's life. Fortunately, chiropractic care is amazing. It really is for people that have been in motor vehicle accidents and people that suffer with whiplash, because it really does something and it could really, really help them. So look, if you've been in a car accident, you've been listening up to this point, regardless if there's a lot of damage to your car or no damage to your car, you know, you need to get yourself checked out for injury. Come on in, let a specialist take care of you. And if it's not me, then go to another chiropractor that specializes in that. I'm Dr. Jason Torado, your West New York chiropractor. I'll see you soon.